Welcome to the Health and Wellness Show. This is Paul Hambleton. Today we're going to be talking about TMJ disorders, headaches, and stress. We're going to do this from the perspective of a doctor of chiropractic who's also an acupuncture provider. Today we have Dr. Amrita Kharkar with us. Welcome to the show.
Hello.
It's a pleasure to have you on the show. Before we start off, I was wondering if you could just tell us a little bit about how you got started in your field.
Sure, Paul. As you said, I'm a chiropractor and as well as acupuncture provider. When I was younger, I always liked working with people, and I had a specific interest, which I learned of in undergrad, in exercise physiology. From there, I ended up shadowing a chiropractor, and I found it really fascinating. It blended very well with my academic interests, and I knew it was something I'd enjoyed doing. And of course, helping people feel better is always rewarding. And specifically, I'm finding it's those individuals who have not improved after using other therapies that's specifically very rewarding.
Great. So do you have a special area of expertise in your practice then?
I do. I specialize in neurofunctional acupuncture and active release technique. And I also have a special interest in treating running injuries. And I'm a writer as well. I write for Suhag magazine as a health and fitness columnist.
So I imagine there's quite a bit of training and experience that's been required in order to get to your level of experience where you provide the healthcare treatments now. Can you tell us a little bit about that?
Yeah, for sure. So obviously my undergraduate education was at Western University, physiology and psychology, which you need in order to get to chiropractic school, where I went to Canadian Memorial Chiropractic College. And from there, I did a acupuncture designation at McMaster University. It's called the Contemporary Medical Acupuncture Program. And and now I'm here.
And now you're here. So could you explain a little bit about how acupuncture actually works?
Yeah, for sure. So acupuncture there's a couple of different ways in which acupuncture does work. First, of course, by inserting a needle into your body, you're causing inflammation and tearing, which is actually a good type of inflammation. It's increasing blood flow to the regions locally. Therefore, you're bringing oxygen to the regions and stimulating the body to be able to heal itself. And secondly, acupuncture has also been shown to have a neuromodulatory effect in the body. And what that means is it can actually affect the nervous system, and for a lot of individuals suffering from chronic pain, it's their sympathetic nervous system that's overactive, and that's the fight or flight type of system that gets worked up. And acupuncture actually settles down that activity, releases pain-relieving hormones such as endorphins. And to have an increase in effect, you can actually stimulate the acupuncture needles with electrical current.
So taking that as a base, what type of services do you provide in your clinic?
Yeah, so I'm a trained contemporary medical acupuncture provider, an active release technique specialist, which is a soft tissue technique, and rehabilitation specialist, as well as I provide chiropractic treatment as well. And what I try to do, I not only assess for pain, but also for overall function, and I strive to help individuals improve their performance.
So I imagine there's a wide range of conditions that you see of people coming into your practice. What are some of the most common types of problems you see in your patients?
Yeah, for sure. A lot of my practice is based out of Toronto and in a financial area, of course. And the majority of people I'm seeing, a lot of them are office workers with postural problems, many of whom have headaches as well, which can be related to the TMJ. And a lot of them are just attempting to try to introduce health and wellness into their lives, and I think it's a great way to do it. So that's probably the most common thing that I see.
So you mentioned the TMJ disorder. That's an area I wanted to focus in on today. If somebody came into your office that either knew or didn't know, but TMJ was the issue that you're getting into, a TMJ disorder, how would you go about treating a patient with that type of condition?
For sure. For TMJ, so for those of you listeners that might not know, it's the joint connecting your skull to your jaw, your temporomandibular joint. A lot of individuals suffering from this are suffering from chronic stress as well. The stat is quite high for TMJ in Canada. It's about 1 in 10 Canadians. And what I usually ask people first off is if they grind their teeth at night, and that's a good indication that the TMJ might be affected. So what acupuncture can do to help heal the tissues and joints, it can do it locally, so just in the area of the muscles, the lateral pterygoid and medial pterygoid, and it can also help to decrease the levels of stress hormones circulating in the body. That will probably reduce the grinding, which will then reduce the wear and tear on the joint and the straining of the surrounding muscles as well.
So what about headaches? Is that similar type of treatment, or could you tell us a little bit about how you go about treating somebody who came into your office with headaches?
Yeah, for sure. Yeah, so similar treatment for sure. But what's really important with headaches is you kind of have to really correctly diagnose where the headache is coming from. For headaches, migraine specifically, there's good evidence for acupuncture having a good effect in treating migraines. A lot of times headaches are not, people just, I have a headache, but it's actually maybe originating from the TMJ or the neck region, and treating those areas can be really helpful in reducing the intensity, frequency of the headache. I do a lot of points in the hands, the feet, the head, the ear, and of course the neck and TMJ if it's needed, to calm down the nervous system and pretty much divert blood flow to the appropriate areas and try to stimulate the body's natural healing mechanisms.
So it sounds like you do an assessment, or an assessment's been done to see what type of headache the person actually has, and then based on that you'll provide the appropriate type of treatment.
Exactly.
You mentioned office workers earlier, and I just have a vision in my mind of people sitting at their desks and being overworked these days.
Mm-hmm.
And what type of role do you think stress plays in the conditions we've just discussed, such as headaches and TMJ disorders?
Oh, for sure. Stress is it's very much related to pain, for sure. They've actually found that chronic pain and chronic stress, they've shown to have similar effects in the body. It can lower your immune system and basically affect the body's ability to heal itself. So we already know, evidence-wise, that a biopsychosocial program is very effective in reducing the effects of chronic pain and stress. And acupuncture is actually just another great adjunct in helping to achieve those results. Acupuncture points for stress and chronic stress specifically. Like I said, with the headaches, they're located on the head, the ear, the hands, or the feet, and these are actually traditional Chinese medicine points.
So we've talked about some specific conditions such as stress and headaches and TMJ disorders. Now, people often come in because they have a specific acute problem like that, and obviously part of your job is to help people get over that. But in terms of overall wellness, how can your approach lead to a patient getting more of an overall sense of wellness?
Mm-hmm. So for sure, I think one of the things that I try to do with my patients is to try to empower them to try to, take control of their pain and their lack of function that they're kind of experiencing. Like obviously, the combination of these therapies, acupuncture, personalized rehabilitation, active release technique, chiropractic therapy, it's one part of a larger picture of health and wellness. But it does take a lot of willpower and commitment to get to these results. And yeah, so I really try to educate them as much as I can in order to, try to get to where they want to be and hopefully have a healthier lifestyle at the end of it.
So then, as a couple of tips for listeners, if somebody had headaches, or if they had stress they knew they had in their life, or they had a TMJ disorder, and they're looking to find out a little bit more, would you have a couple of important tips that you could pass on to people about those issues?
Yeah, for sure. There's obviously a wealth of information out there, on the internet now. A lot of people coming in already have a good background, or at least they think they do, about their condition, and sometimes a lot of websites are not the best to be consulting. So obviously they can contact their health providers for more information. I have, I'll give my contact information as well if they have more information, want more information. But they can also review good websites such as the Mayo Clinic that actually has pretty good evidence-based information. If they're actually looking into finding research itself, the Cochrane Review website has very good articles. They have high-quality research studies called meta-analyses, and that's pretty much the best type of evidence out there.
Terrific. Now, if someone were looking to visit an acupuncture provider, What would some things be that they should look for?
Yeah, so in Ontario, obviously anyone can, there's schools all over the world in acupuncture, but they should definitely make sure that whoever they see for acupuncture is licensed to practice in the province of Ontario. And the way that I practice, of course, it's through my chiropractic designation, which is a lot of other health providers are able to do as well.
Fantastic. I'd like to thank you very much for being on the show today and providing your expertise and some great insight into people who are experiencing headaches and TMJ disorders and stress. Now, if listeners want to get in touch with you, what's the best way that they can do that?
So the best way to get in touch with me is through my email address. So it's dramrita.well@gmail.com. So I'll spell that out. It's DRAMRITA.WELL@gmail.com.
Great.
Yeah. Thanks for having me on the show.
Yeah, thank you for being on the show. We appreciate it very much. Bye-bye.
Thanks.